Hello, everyone. We would like to respectfully, I'd like to introduce myself first. That would be a good start. I'm Michelle Smith. I'm Regional Practice Lead with the Research Department in Interior Health. And I'd like to welcome all our webinar guests to our presentation today. We would like to respectfully acknowledge that UBC Okanagan is situated on the traditional, ancestral, unceded territory of the Okanagan Nation. And I would also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands. Welcome to the 10th annual Okanagan Embrace Aging Month, and thank you all for joining us today. We're very excited about the 10th year, the big monumental step. Embrace Aging is co-hosted by the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan, Interior Savings Credit Union, and Interior Health. UBC Okanagan has joined the global network of age-friendly universities, formalizing its pledge to make UBCO more accessible, intergenerational, and committed to research programs that are informed by the needs of an aging society. If you would like to know more about the age-friendly university initiative, have suggestions for us, or would like to get involved, please contact the Aging in Place Research Cluster. And we'll put the email in the chat and web in the chat as well. That's email aging.inplace@ubc.ca, and the website is aginginplace.ok.ubc.ca. Embrace Aging Month was launched 10 years ago to celebrate and raise awareness about positive aging, and has once again organized a number of educational opportunities and events during the month of March. The sessions are designed for everyone, young and old alike, and focus on a variety of topics related to healthy aging and ways to improve quality of life among seniors and their family caregivers. Our goal is to inspire everyone to embrace positive aging. We have closed captioning. The closed captioning box can be moved to your preferred place by clicking and dragging it to where you'd like it to be. To turn off closed captioning, select the hide caption button at the bottom of the bar. Type questions or comments for the speakers in the chat box during the presentation, and questions will be read out at the end of the presentation. Today's event is brought to you with support of Embrace Aging Month. Today's session is stimulate your brain motor imagery as a tool to enhance recovery after stroke. No. My apologies. I was like, I don't feel like this is the right topic title. Reducing. Apologize, everyone. A little copy and paste there. Today's event is Reducing Isolation, the Aging Well Penticton Experience. Apologies for that. Our speakers, Patricia Tribe, Project Coordinator, Aging Well Penticton, OneSky, and Tanya Osborne, Community Health Facilitator, Interior Health. Thank you both for coming. I'll pass it on to you.
Thank you, Michelle, and hello to everybody. So Aging Well, we're going to talk you through the who, what, where, how, and a variety of other things through our slide presentation. Please put any questions, as Michelle said, in the chat, and we will answer any questions at the end of the presentation. So next slide, please. So Aging Well is started off with OneSky Community Resources, the Penticton Seniors Drop-In Center, and the Seniors Wellness Society. They co-wrote a grant application to the federal government. And for this grant, it was a very specific grant. It was a focus on seniors isolation. And it also required that the grant be in one location. And so the location in this, for this particular one, is Penticton, which is a little different because most of the organizations involved in this project work regionally, as I'm sure some of you out there do. But this one is specifically focused in Penticton. And the grant is the New Horizons for Seniors grant, and it is a 5-year project. And when we were awarded the grant, there were 21 other communities across Canada that received the grant. So there's not a huge number of folks that get this every year. So we were very fortunate and very thankful to have it. If you are looking at New Horizons for Seniors grants, there are two kinds of grants. There's this one that we got, the large 5-year one, and then there's also a smaller one that's a 1-year grant that is, I believe the denomination is 25,000. So they have two different grants out there. The reason that this team of folks, the three folks got together was, as you can see in the stats, for Penticton, 29% of our population are 65 years and older. And that's well above the average, which is approximately 18% for the province of BC. And there are a lot of folks who are caregiving for a loved one, and 31% here. And then 17% of the seniors in our region live in poverty. And so that's a pretty high number as well. So there was some reasons to look at those numbers and say, hey, we need to put together a grant and see what we can do to help support some seniors within our community. Next slide, please.
Patricia said, a senior's isolation, it was a big part of this grant, and we all know that isolation is bad for health, both physically and mentally. Social isolation is often associated with increased rates of mental illness, lower self-esteem, and increased stress levels. Those who are socially isolated experience higher rates of unhealthy behaviors such as smoking, drinking, and being inactive. And at the community level, a low social connectedness has been linked to wider societal issues such as crime, alcohol abuse, and even suicide. On the other hand, though, having social connections and a strong social network are an important part of healthy active aging. Social support is important for buffering the effects of adverse events or stressful life circumstances. And some research indicates that belonging to a social group and network is just as important a predictor of health as diet and exercise. Building and cultivating social connections benefit both the individual and their communities. So social connectedness really helps communities thrive.
So that's the why we wanted to do this. And the how is, some of this was dictated from the federal government, but the process is called collective impact. And this process is just as it sounds. Together as a collective, we can have a greater impact on the challenge that we're trying to solve, or for the audience that we're trying to provide services to. So the collective impact method has 5 different areas to it. One is a common agenda. And so together we worked with several organizations to build up a shared vision for the change that we wanted to see in Penticton. And we came to a consensus on that vision, and as a joint approach, how we're going to approach fulfilling that vision. Then the other part is a shared measurement. And so this is where we collect data and we're measuring throughout the 5-year term. And this helps us to stay aligned with each other and keeps us accountable for what we're doing, making sure that what we are doing is working. And also that shared measurement goes back to the reporting at the federal government. And then we have mutual reinforcing activities. So the activities need to be different but coordinated. So each organization involved can work to their strengths, and we aren't duplicating programs or activities. So it also allows us to support each other as organizations. Instead of working in silos, we can start collaborating more. And for instance, if there's an organization that has a program that they're providing for seniors. Then another organization has a newsletter that they're putting together to go out to seniors to give the seniors information. They will work together and promote the program in the newsletter. Instead of working in these silos or competing, we're working together to try and get all the information in the programs out to seniors. The other one is continuous communication. And that is amongst the team, and we'll show you who the team is in just a minute. There has to be this trust that gets built because we're dealing with a lot of challenging topics. And we have to have that shared common agenda. And that is a really key point. And so whoever became involved in this project had to be committed to be involved for the 5 years. And then there's a backbone, and that is the person who is coordinating and the participating organizations and agencies and that sort of thing. And in this case, that would be me. There was another person involved who wrote the grant and got this all up and running, and his name was Ian. I'm not sure if he's on here or not, I can't see. But he was very vital in getting all of this going. But now the backbone person is me. Next slide.
So as mentioned in my introduction, I am a community health facilitator, and I'm part of the Healthy Communities team with Interior Health. And my team is a dedicated group of people who are focused on supporting the health of communities from a population level, ultimately to create healthy communities. And this project really aligns with it because a part of healthy communities is having socially engaged seniors. They're key to having a healthy community. We also know that supporting healthy communities requires a collaborative effort and is a shared responsibility. Everyone has a role to play, and this includes health authorities, community organizations, businesses, schools, and local governments.
So our healthy community for this project, and I'll say that with little quotes up here, is what we call our North Star. And this is what the team of folks came up with as our shared common agenda. And that is a community where every senior feels connected and a sense of belonging. And we felt that if we can reach that, then we won't be dealing with a lot of isolation, and seniors will be healthier, and there will be support throughout the community, and so on. So that's our what we call our North Star for our healthy community here in Penticton. In order to reach that, we had a lot of discussions on what is important for Penticton. So the beauty of this grant is that it is focused in one community. And so you can really narrow in on that community and what the needs are for it. And so what we came up with as the 5 pillars of whatever we are going to be doing as far as projects and programs and our vision is going to focus in on one of these 5 pillars. So the first one is reaching out and supporting people in their homes. We know that that is vital for the quality of life for seniors, and obviously makes for a healthier community if seniors can be supported in their homes. Promoting an active social life. These are pretty obvious, but that will make you healthier, and it will also help with the isolation because typically you will be in a group setting. And boosting mental wellness and community. You know, we started this project before COVID, and then we were hit with COVID. And so we know the mental wellness component of isolation, and so we'd like to help boost that within our community. Enhancing natural supports. So those are the folks that may naturally be supporting a senior, caregivers, partners, children of seniors. So enhancing and supporting those folks that are doing the job that is vital to keeping seniors healthy and happy, and collaborating for a friendlier system of home and community care services. So in our discussions, you know, it was pretty obvious that a lot of people and organizations are in these silos. And we wanted to break some of those down so that we were making it easier and user-friendly for the seniors, so that there was a
Patricia,
I think she's a bit frozen. How are you doing? Is Tanya's yours? Let's see. Jaquetta, can we, or if you want to text, I don't have Patricia's number. We could text and see. Maybe she can start like log back in.
I can continue a little bit as well. If we, oh, there's
Oh.
oh, you're on mute.
There we go. I'll unmute myself. So I guess our little electrons went for a ride there. Next slide, please. So I keep talking about us. The us for this project is our leadership team. And as you can see, there's the OneSky Community Resources, the Alzheimer's Society of BC, the City of Penticton, which is important, a different organization, it's not a community organization, obviously. The CMHA for South Okanagan, that's the Mental Health Association for South Okanagan, Interior Health, which is where Tanya is from, the Penticton and District Community Arts Council, the Seniors Drop-In Center, the South Okanagan Immigrant Society, the South Okanagan Loss Society, and Seniors Wellness Society, and South Okanagan Milkman Brain Injury Society. We've had a couple of other, these are sort of folks that started right at the very beginning and have stayed. We've had a couple of other partners. One was the Okanagan Friendship Center that were in for a while to address some of the needs that they were seeing with elders, and then changed direction. And so they're not with us now, but they did do part of this project. And also the South Okanagan Milkman Division of Family Practice has been involved in order to, and we'll talk about this a bit later, to set up a new program. And recently the United Way has joined our leadership team. So the majority of people are there and have been there for a long time, but there is that flexibility to bring people and organizations in as we see the needs or the gaps. And you can see that's quite a wide range. Some organizations specifically focus on seniors that are involved in the project, and some are seniors are just a part of their audience. And so we felt that was important because we wanted to make sure that we had a range of organizations that were offering different things. And then you know, we have, for instance, we thought it was very important to have the Arts Council. So not all of our programming is focused on a narrow audience of seniors. We wanted to expand it. We have the City of Penticton, it's their recreational division and their social division that are part of this project. But, you know, the recreation is over there in the City of Penticton. We have the arts. We have counseling, and, you know, so just a wide range. And we felt that was really important so that we weren't having a narrow audience of seniors. Next slide, please.
So in addition to the 5 pillars,
the project really is bigger than just the seniors that we're supporting. Aging Well Penticton has brought together multiple organizations, as you can see, many whom might not have thought to come together naturally. And at the steering committee table, we've built capacity within and among each organization. We've built relationships, shared resources, and collaborated towards this common cause. These established relationships have then enabled members to connect outside of the table about other areas of work, which just goes to further expand each of our capacities. As the Healthy Communities team representative at the table, I was able to bring forward health evidence. I also provided the table with a link to health experts. I came to discussions using a health equity lens and looking at issues from a population level, which provided a very unique perspective to the table and the discussions.
And again, it's awesome because we have a variety of unique perspectives, and that's really helped make this project work. So how do we know it's working? And one of those things that we talked about at the very beginning we have to do is shared measurement. And so all of the organizations are tracking the programs and the effect that whatever it is that they are doing is having on the seniors. And so we had short-term, intermediate, and long-term outcomes that we were looking at. And this is might be a little fuzzy for you, but we learned, we can't accomplish everything all at once. So we timelined out what we thought would be the best way to evaluate as we're moving through the 5 years. And some of the evaluation is on how the leadership team is doing. Other evaluation is on how the programming is doing and affecting seniors. And then we also need to look at how we might be affecting the system of care for seniors. And all of this, of course, is with the goal, that last one there, for the quality of life of our seniors in the community. I think everybody can read the little dots there to go through that. I won't read through all that. I'll just pass it off to you, Tanya.
Thanks. So working at
is where I come in, obviously, and a lot of my work is focused on system level changes, but these types of changes don't occur overnight. We need to build up to them. And as shown here, system level changes in the communities are outlined as intermediate to long-term outcomes. And after 4 years of working together, the steering committee is starting to talk about collective advocacy and the implications of policy changes internally and at the community level. Together, we're working towards system level changes and improved quality of life for all seniors living in Penticton.
So this project is one that is an example of how we can start to shift policy and make some system level changes. This project began with us discussing with the Division of Family Practice, Interior Health, physicians, OneSky Community Resources, and Aging Well. We all came together and for about a year worked through the behind the scenes challenges of bringing us together to work towards a project that will help seniors. So we noticed, I'm saying, when I say we, I mean either the physicians or the Division of Family Practice or Interior Health, noticed that seniors who are isolated and weren't connected to community projects or community supports, pardon me, were utilizing the emergency room more. They were seeing their physicians more, even just for some of that interaction. And then from the physician's point of view, the physicians were saying, well, we see these seniors and we ask them to do something or we prescribe something, but we aren't seeing the follow-up. We're not seeing what's happening with them in respect to how they're doing in community. And then, you know, in between that, the seniors could be really struggling and getting to a point where they're having urgent health needs. And so, you know, there was some gaps there. There's multiple organizations trying to help seniors, but nobody was talking to each other. And so we discussed how we could make these big entities of, you know, the doctors and healthcare workers and interior health and the community come together to create a system where the senior is better cared for. The doctor's offices and emergency rooms hopefully will be utilized less while keeping the doctors in the loop. And we're providing a better quality of life for seniors. And so that's what we call the Connector program. And this program is a work in progress. It has been up and running for about a year now. And so it is still up for debate on how well we're doing. But this is what, next slide, please. This is what the Connector program looks like. We needed to start small, expand, as this is a big change like Tanya was talking about. So we created some criteria to help us identify if a senior is at risk. You can see that on the left-hand side of that graph. And if the senior is a good fit. We couldn't open it up to everybody all at once because that wouldn't be a great research project, and we wouldn't be able to follow our data and evaluate as well. And so we stuck with people of the age of 75 and older, if they were socially isolated, if they had increased fragility, and if they were vulnerable and needing urgent health and social supports. And so those were some of the criteria that we looked at when we came across a senior that might be a good fit for this program. And then the unique thing of this is that, you know, if the senior is talking to the primary care, the physician or the nurse practitioner, or if they're talking to, going to a walk-in clinic, or if they're working with interior health, a case manager, or if they're going to a community organization. Any one of those groups can refer a senior into the Connector program. And so it's not referring somebody into your own program, it's referring a senior into the Connector program. And then, as you can see, when that happens, we do in-home assessments, we liaise with the senior, obviously, and see what their needs are, what they want. And then liaise with the primary care physician. So we're closing that loop. So if we're doing regular check-ins and work with the senior for up to a year, then we keep the physician informed as to how that is working. And then we prioritize what kind of programs or services can the senior use within the community, not necessarily within interior health or within from the doctor's office, but how can the community-based organizations help with the seniors' quality of life and keeping them at home, out of the emergency room and out of the doctor's office as much. And so you can see then below what some of those social supports and health supports are. And as I said, we're tracking all of this. And so far we have one connector who is slowly starting to expand out to different physicians' offices. We will let you know in the long run how it turns out. But so far, it's making quite a difference to the seniors that we're working with. Next slide. Another example of a program that's happening through Aging Well, and this one's through OneSky and Senior Wellness Society. This is purely about socialization. This one, you know, sometimes we forget that seniors are these people who have had a lot of fun in their lives. They like to laugh. They like to learn new things, as the folks that are probably on this are. And you have a lot of great stories to tell. And I absolutely love this program. I worked this program for a little while, and we would get groups of seniors would just sign up, and we get people going out to lunches together, going out on trips. You see the one picture there is a group of folks on a bus, and we're going on a trip to a local destination. And you know, this enables the seniors. It's great in multiple ways. You get out, you're more connected to your community and your greater community. You're not just stuck in the neighborhood that you're used to, or in the city that you're used to. You're getting out and seeing other parts of our beautiful Okanagan Valley. And obviously you get to socialize. And from this, you know, several people have found really good friendships. And so then that's one of those natural supports that we talked about earlier, that, you know, if you're having trouble on a day, you can phone your new friend and say, hey, do you want to go for coffee? Whatever. And so those connections happen just naturally when you get people together and you're out and having a lot of good time. So examples, like we went down to a Soyuz for a beach trip. We've gone to Critter Aid to meet some of the amazing animals that they have there. We've gone out to the grist mill, you know, just a variety of things to keep them connected to the greater Okanagan Valley, and to just have a great time. Next project, next slide, please. One of the other things that we're working on that is still a work in progress as well is extreme heat and emergencies. You know, as we showed on that screen, we have a high population of seniors in our area, and we are at a very high risk for fire and heat domes, some with flood. But you know, this climate change is changing, and we're not going to see these things go away. We're going to see these things become more and more of a challenge for us. And so with this project, the City of Penticton and the RDOS, which is our regional district, are the lead entity. And they're working on how community organizations, such as the ones involved in Aging Well, can fill gaps to what they're doing and advocate for our specific audience. So advocate for seniors when there is extreme heat or emergencies happening. So an example of this is, you know, in discussions, it's set up for the City of Penticton, which is wonderful. I'm signed up for it. You can get a text or an email if there is an emergency about to happen or happening. And that's great. That covers a lot of people, but there's a lot of seniors that do not have cell phones or are not connected to the internet. So we need to, you know, bring this awareness to folks that are putting these projects, the emergency preparedness projects together, and say, hey, look, we need to also have a way to contact seniors through phones, because not everybody has all of that technology. And so we're in there advocating for seniors when the city and the RDOS are preparing for their emergency preparedness. We are at the point of working together with the city on, you know, communication. So on some workshops, and how can we get some neighborhood connections going to help neighbors helping neighbors, some of those natural supports. Are we going to be having some portable AC units? Can we talk about electric bill forgiveness during a state of an emergency if it's a heat dome? When you have your cooling locations, how are seniors getting there door to door versus having to stand in 40, 50 degree weather at a bus stop to get to a cooling station? Where can they recharge their wheelchairs when they're there? So this is something that we are working hand in hand with the City of Penticton, and we're hoping that you know, as this one continues, we will be able to provide the necessary components for seniors when an emergency happens. Obviously, seniors have to be responsible for themselves as well, but there's just some things that we can help support. So that's what this project is about. And what's next? So we have, next slide, please, Tanya. I don't know if you could hear that. That was my dog asleep, having a howl. So our next focus is this continued collaboration and continue doing the programming and advocating for policy change. And one thing we haven't talked about is the City of Penticton is becoming an age-friendly community, and we've been working with the City of Penticton for that. And so we will continue to engage and support the City of Penticton for that designation. And then long-term, our sustainability is for this next year, we're focusing on how we continue, since we have such great momentum going with Aging Well, and we're in our last year of this project that's being funded from the New Horizons grant. How can we continue to build this community where every senior feels connected and a sense of belonging? And that is working with our partners and applying for other grants and becoming creative as to how we can sustain this project. Next slide.
So we wanted to end with a story. So finding your way in the world after the death of someone you love is difficult. For Ken, the sudden death of his wife, Sammy, after 42 years of marriage was a wrenching tear in the fabric of their quiet and private life. Ken says, "It was just the two of us for 42 years. We were very independent. Our talents complemented one another. Their home, their music, and their work provide satisfaction and filled their lives together." Describing Sammy as a natural with technology, Ken now finds himself not only coping with completing the lonely duties that follow a death, but also struggling to develop competencies that he relied on his wife for. He says, "I'm a fish out of water, deeply challenged with the bureaucratic aspects of losing my mate. We had intended to cross-train each other in the skills we each brought to the partnership. Sadly, we did not have time." Without a strong natural support network, Ken found himself, as he puts it, emotionally floundering. Social isolation is a big problem for me, he says. He sought out the South Okanagan Lost Society, a local grassroots organization which provides grief support. He says, "It's been very hard, and Souls has been a lifeline for me. I have met people with whom I share a common experience." He has also been endeavoring to connect with others who share his love of music, a significant interest in his life. Already a confident and experienced guitar player, he's taken up the ukulele and has participated in a group at the Seniors Village. He hopes to find more ways to celebrate his pleasure in playing and music, listening to music. The challenge of rebuilding, developing new habits and rituals in his life is complicated. Upon being interviewed, he said, "How do you start again at 75? I've had such a significant other. I don't want to be alone. I look for moments of distraction and give myself credit for the things I have accomplished, even if it is just one thing that day. I have hope that it will get better and easier over time and with practice." And that's just one story of the many seniors that this work has touched. Patricia, did you want to say anything else about that?
Yeah, that sums up, where working together, we can be a community where every senior feels connected and a sense of belonging, even though life has changed. So that's it. We'd be happy to take any questions if you have any. Michelle, we can't hear you.
Yeah, you're mute.
La 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 la. It's one of those. Thank you, Patricia and Tanya. If anyone would like to have any questions, please put them in the chat and we can read them out when my mute is off. On. We have a few minutes for questions before, and I while we're waiting for questions in the chat, it's just an amazing project that you've been working on, and a huge project.
Yeah.
You must be very proud of what's been going on and everyone in it, because that's a major collaboration. And that story made me cry, so I had to have my camera off for a minute.
We have quite a few of those stories. We weren't sure which one to choose for this.
Yeah.
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 Yeah. No, it's been great. It's been great fun. It's been great to see community coming together and different organizations coming together. And it's been quite an honor to be part of it. So, oh, I see
Wonderful.
a question.
Yes. How have you had to adjust during COVID-19?
Yeah. A lot. So we had some unexpected benefits actually from COVID-19. And by that, as the leadership team, we're meeting monthly, and everybody has made it a priority to be on those monthly meetings, which, for 4 years, that's a big commitment, and we're continuing. So that's a pretty neat thing all in of itself, the commitment of organizations. But during COVID, we got together on these leadership team meetings, and sometimes I mentioned Ian and I might have to throw out the agenda that we were thinking of, because we as all these different community organizations had to share, how are we changing things, what's working for somebody, what's not working for somebody. And so there was a lot of on the fly great discussion on how, okay, if you're going to change that, let's put that in the newsletter. I can support you. I have a location that's big enough for you to host your counseling for souls, for the grief and loss. Another organization had the room that was big enough. So we were able to work together to make those changes. The other thing that I think was a positive, I'm trying to find the positives, is before, when we started, isolation of seniors was not something that a lot of people talked about. And then when COVID hit and everybody had to become isolated, and we were isolated from the seniors in our lives, we all of a sudden had this awareness of how difficult life can be for some of the seniors, the folks in the homes, and for folks at home, and how isolation affects everybody. And, so it's one of those things that until you walk in somebody's shoes, you don't really understand it. And so everybody had to walk in the shoes of seniors who have been isolated, or anybody who's been isolated. We all found out how hard that is. And so it brought awareness up about isolation. And so we did not have to spend as much of our time as a team working on that awareness component. It happened for us. And so some of the people put their programs online for a while, and did counseling online. Some of the out and about activities, we continued them through COVID, but we limited the group size. We did as much as we could outside, so that we were reducing the risks and all of those things. So there definitely were changes, but I want to make sure, we don't just dwell on the negative. There were some positive things that came out of it as well.
Make it happen.
Yep.
Maddie says, thank you for that. And Emma's asking, can you see this project inspiring other initiatives like this throughout other communities in Okanagan, or have a shareable framework for cities, towns to take on?
Yeah. And that's one of them. Thank you, Emma. That's one of the reasons why we wanted to present this project. We're not finished to the project yet. We want it to continue. And, we think that what we have done is something that can be replicated in other communities, and even taken a wider, perhaps from Penticton wider down through the South Okanagan. Kelowna, larger city in West Kelowna, might want to have their own projects, that sort of thing. But we're always willing to work with and share our knowledge with anybody. If there's folks out there wanting to start something like this, it's been worthwhile. So hopefully, yes, other communities will pick that up.
I can just add a little bit that like my role is regional, and so I take the experience from this and take it elsewhere, and I say, hey, this is what in Penticton. I know every community is different, but that knowledge can be taken forward and shared, and the excitement can be replicated. And hopefully we can do similar things.
I could see very advantage across so many places to be
Yeah.
able to spread it. Emma says, awesome. Thank you. There's just so many opportunities. Yeah, like we all need aging friendly communities.
Yes, we're all going to be aging. It's like, if we're lucky, we're all aging.
Yes. I like the way, like the focus on the person. So like you're bringing everything around, wrapping it around the person, which is
Yeah, it's
keeps
easy.
those silos away.
Yeah,
Yeah.
it's easy to wrap around an organization, but you don't want to do that. You have to remember who our customer is, and that's the senior, right?
Yeah. Do we have any more questions you want to put in the chat just before we click here? Okay. Paula, I appreciate the framework and sharing and capacity community building with the focus on seniors. Super powerful. Thank you. Janice, if I'm understanding correctly, you have a 5-year grant for this project. 4 years have passed, 1 year left to go.
Correct. Yes, that's correct, Janice. 1 year left, and we're going to be focusing on how we can sustain this after the 5 years.
Having a coordinator has been a huge, well, it's been the driving force of keeping us all together, because otherwise each organization would just go off and do its own thing. And so having Patricia be the coordinator, pull everyone together monthly to have discussions has been absolutely essential. And so we do need to, we're looking at different grants or different opportunities in which to continue to fund a coordinator, because it's not something you can do off the side of your desk.
I'm not even there, and 100% no, that is 100% true. We need to be the glue that makes all the coordinator and the champion all in one to keep everything. I'll have to keep looking at grants. Yeah, funding. Janice says agree.
Janice is probably doing some of that somewhere.
Feels exactly, yes. Excellent.
All right.
As we're coming close, anyone wants to throw those questions in there, I'll just give some more information on the last part. So again, thank you, Patricia and Tanya. It was it's amazing, like all in the detail that how you presented it, and easy to share. Being there, Janice says, well done. Thank you so much. And everyone that's attended the webinar today, it's always great to have people come in and listen and share and give questions and comments. And it comes out on YouTube. We'll be recorded. It's recorded, and you can follow up later as well. And we'll share the link widely. And so we encourage you to all attend other events for the Embrace Aging Month, the happy number 10th year. Please visit our website. And I'll say it slowly because I always say it too fast. Okanagan Embrace Aging.com for all events and registration. We look forward to growing this event in the Okanagan and encourage anyone interested in supporting Embrace Aging in the future. Please contact us. Contact information is available on the website. You will receive an email with a link to the online evaluation form. We welcome everyone's feedback, suggestions for planning Embrace Aging events in the future. And next year, we can hear more about how this last year's been from Tanya and Patricia. We've already booked you in for next time.
Awesome.
Just throwing that out there. It'll be good to hear how things are going. So thank you. Anyone else? I don't see you questions, but if you have any, you can always follow up and we can connect you with Tanya and Patricia. And thank you again